This is WVUA 23 News.
Good evening and thank you for joining us. University Medical Center has brought us excellent health news and advice this past year. And this time of the year, we're all desperate for a good night's sleep. It's more than just a luxury. It's a medical necessity.
Hello, I'm Dr. Richard Friend, Dean of the University of Alabama College of Community Health Sciences. Our college operates University Medical Center, which is the largest multi-specialty medical practice in West Alabama. Our mission at UMC is simple: to improve the health of communities. One way we do this is by providing relevant and timely health information to the public through Health Matters.
So sleep apnea is really a category of disorders. There are three main subtypes, and what we normally in everyday conversation call sleep apnea is actually obstructive sleep apnea, which is where the airway either blocks completely or partially blocks while the person is still trying to breathe. This can disrupt sleep, it can cause full awakenings, but the average person who has this disorder doesn't know it. They are usually told by someone who sees it, or they present with a completely different symptom that then leads towards the diagnosis.
Our weight is another health matter many of us are fighting, and no one wants to hear we're obese. It helps to know what the term means and what you can do to prevent it.
Obesity, when you think about for adults, it's really reflective of your BMI or your body mass index. And the way that's calculated is it's just looking at how tall you are versus how much you weigh. In adults, obesity is considered anything higher than 30. Overweight is anything higher than 25. But in kids, you know, kids are always growing. They're getting taller, their muscle mass is changing, their body's growing. And so really what we use is we look at the percentiles in correlation with their BMI. And so their BMIs are going to be changing all throughout life. Anything higher than the 85th percentile, when you look at the BMI for that child based on their gender and for their age. Anything higher than the 85th percentile is going to be overweight, and anything higher than the 95th percentile is going to be considered obese.
There's a new class of drugs that have proven successful for weight loss. They were initially used for diabetes treatment, and doctors have found they help some people lose weight. Here's how they work.
Ozempic was originally studied and marketed for diabetes, and when they saw that those agents could help with weight loss, then the drug companies pursued indications for weight loss, and they look at higher doses in patients for weight loss than the doses that we use for diabetes. It decreases appetite, and it decreases movement of food through the stomach. And by decreasing appetite and decreasing movement through the stomach of food, then you have fullness quicker for patients. And so they're gonna target different avenues to help with weight loss.
So these drugs are not the magic potion for everyone. You and your doctor need to weigh several factors to find out if they can help you lose weight.
I think there's a common misconception that if I take a medication or what have you, that's going to fix it for me. And we really want to encourage people that we've got to, this is a great time to start some habits that you may not have tried before. Talk with your doctor, and likely your doctor, she or he will talk with you about this. What medications are you taking? Will your body use them the same way? Okay, if you're feeling full on less food. Are there things such as, is it appropriate for me to maybe, will I lose weight too quickly, and I could have some other health conditions that need to be addressed? So definitely have a conversation with your physician. Don't just run out and purchase it without talking with your physician first.
Many of us become overweight and out of shape when we fail to eat right and exercise. We're simply too busy with work, children, and our jobs. That's why a healthy perspective is so important.
So work-life balance, that's a huge shift because, if you think about it, we're still trying to find it again with everybody coming through COVID. right? Everybody wanted to be home, and then unfortunately we all got it in a way we didn't want to. And then now you have people that sometimes don't want to go back to work. And so then where is the balance? Because in the traditional model, it was like, I went to work, and when I went home, I was away from work. But then if you start working from home and you've never done it before, well, now work and home blend together into this one continuous thing. And I think sometimes, especially I've read some articles and seen some other folks talk about, the balance is finding out the times where you can work the best for you.
From your physical health to your mental health, they go hand in hand. Your body feels it when you're worried or anxious.
Yeah, anxiety is a broad topic, really quite broad, in fact. But I kind of describe anxiety as a sense of uneasiness, maybe a fear, worries, and it can manifest in all sorts of different ways. Probably the biggest thing that people have in anxiety are actually common things that you hear about all the time. People who are afraid of getting into an elevator, or afraid of a spider or snakes or things like that, fear of heights. But it can manifest in all sorts of different ways as well. Anywhere from fear of speaking, like maybe in a situation like this, or fear of being around others in social situations, or just a fear of things in general. So anxiety is very common. It's probably the most common mental health disorder that we actually have. And it's something that is broad spread, not just in the United States, but around the world.
There are ways we can find our work-life balance, ways to deal with everyday stress that threaten our mental and physical health.
So Mindful Coping Power is a novel adaptation of a program called Coping Power that has been around for more than 20 years, also developed by a team here at University of Alabama. And we train folks all over the country and the world really in the Coping Power intervention. And the difference with Mindful Coping Power is we added some mind-body practices, things like meditation and yoga practices, to the Coping Power program, to kind of bring the knowledge and skills that program teaches from the head kind of intellectual level to the full body level, to help children and their parents really kind of understand how they're feeling in any given moment and what they need, and then to act with wisdom based on that information.
There are things you can do for your mental health that also make you more physically fit, and you feel better too.
You're either practicing gratitude journaling, which is basically you're writing down what you've been thankful for that day, right? Or you just are engaging in the practice of gratitude. Maybe you take a time either in the morning, midday, or afternoon, and you pick out 3 things that are going good for your day. Like, I even make it as simple as, like, if your coffee was really good that day, I mean, that's something to be grateful for, right? Because I think sometimes people want to overthink that. And so the practice of gratitude, I think, helps kind of retrain us to start to recognize those things. Because if not, they kind of like walk by us all the time and we miss them. And that's not something we want to do. So, but it also has a lot of benefits to it. And they've kind of shown that.
You can hear the entire interview by visiting our website at umc.ua.edu. And for all your primary health care needs, visit University Medical Center with locations in Tuscaloosa, Northport, Demopolis, Fayette, Carrollton, and Livingston. Thanks for watching, and we'll see you next time on Health Matters.
Medical care is very different for different age groups. When we come back, caring for your children and your parents. We'll be right back. Welcome back. University Medical Center is a true family medicine practice. They offer treatment and help for those youngest patients to the oldest.
Hello, I'm Dr. Richard Friend. Taking control of and improving your health requires the most relevant and timely health information available. And University Medical Center is here to help with facts and advice about important health topics that you care about. We know that your health matters.
So I think it's important to think about what the goals are for our aging family members. So it's not just a plan for the family and how are we going to manage this situation, you know, as mom's getting older. It's not that. It's, Mom, what is it that you think you need? What are your goals? And how can we help you facilitate that? It's not, you know, we have the conversation about caregiving for an adult family member. It's more about caregiving with an adult family member. So think about it like that.
So we see that caring for aging adults is a unique challenge, but it takes an entire family or group to manage geriatric health care.
Caregiving, I think, is the #1 problem. And what we also need to do as a part of that is make sure we're providing the information, just broadly speaking, to the general public, hoping and putting it in settings where older adults would be and or their loved ones, so people learn more about what resources are available. So from minority mental health, often the families are under-resourced and can't provide the care, and or they don't know about the resources that are available that could help them. And that care can be costly. And many caregivers end up losing their jobs if they're still working. If the other issue that comes up with caregivers is their own health. So when they start taking care of a loved one, often their health declines. So it's really important as a caregiver to learn how to manage your own health as well as the health of your care recipient.
At the other end of the spectrum, caring for children has its own challenges. So many things are competing for our children's best interest. Helping them navigate successfully often requires medical care and advice, and that includes attention deficit hyperactivity disorder, and that condition can carry over into adulthood.
The degree of impairment that they have is equal to sometimes equal to somebody who is intoxicated. Yeah. And there are many simulation studies that have shown that ADHD impairment is actually quite high. They're, about maybe 35% more likely to have an accident than somebody who doesn't have the disorder. They're more likely to get tickets, violations because they park and they forget to come put money back in the meter or whatever it is that they're supposed to do. And they're also more likely to be engaged in elements of road rage because of the impulsivity. They tend to have situations where they have an issue with another driver. And as I said at the beginning, one of the core issue in ADHD is difficulty in inhibiting oneself. So when they get into a situation that is emotionally charged, they're more likely to be more charged and get angry and not able to contain themselves.
Another medical condition often diagnosed in childhood is autism. And like ADHD, it can cause problems into adulthood.
Autism is a developmental condition where individuals with autism spectrum disorder may have differences in how they learn, interact with others, behave, or communicate. And that is across a wide spectrum, which is why we call it autism spectrum disorder. We do see that this occurs across all different groups of people, regardless of race or ethnicity, regardless of socioeconomic status or how much you make. I think in the past we kind of had some stereotypes about what ASD looked like, but the research shows us that's not true.
Arthritis is a condition we don't often associate with children, but juvenile arthritis can be just as crippling as adult onset arthritis.
The reason it's called juvenile arthritis is because it occurs in children. So by definition, we're talking about types of arthritis that occur outside the adult population, basically before age 18. And, for older people, many times arthritis is related to life experience. People have injuries, play sports, whatever, and the joints just wear down over time. But in children, it often is something people are born with, or at least they're born with a tendency to have. So they're much more likely to run in families. Many times when children do have arthritis or are diagnosed with arthritis in the pediatric age range, there is a family history of someone else who had something similar, either lupus or some other type of arthritis.
One major and troubling factor impacting our children is increased gun violence. It threatens more than their physical well-being. It also takes an emotional toll.
So we in the public health field have been talking about this for a long, long time. It didn't just happen with the Surgeon General's report. We have been noticing this pattern of gun injuries, particularly in children and young adults, which has been alarming, and particularly in certain communities, disproportionately in some communities. So it's been an ongoing, escalating problem, and I think now why he called it a crisis is it really is at an all-time high. In addition to the direct effects on children, of course, we know that suicide is also a major issue in young adults and children, and firearms is the way that is the #1 cause of suicide deaths.
And there are a lot of outside forces competing for our children's attention, and they can create an extra obstacle to their good mental health. When do you allow your child to have a cell phone? Doctors have some guidelines.
Well, the main challenge is empowering parents to make decisions where they know what's appropriate in terms of at what age their children should be allowed to have access to these devices. What we're seeing in our clinic is that younger and younger children, and I'm talking about kindergarten through 3rd grade, are having cell phones and tablets without appropriate supervision, and that's just too young, and empowering parents to know that that's too young of an age for them to have access to the internet. I know a lot of parents think they're just going to allow them to play games and it's for safety issues, but what happens is they get into other places that they shouldn't, and they get exposed to things they shouldn't be exposed to at an early age. So I think the biggest challenge is empowering parents to see that they are in control, not the children, because the children come and say, hey, you know, I want to have this cell phone, I want to have this tablet, because they see their friends having it, and empowering parents to be parents so that they make those decisions in a more developmentally appropriate and safe manner.
You can hear the entire interview by visiting our website at umc.ua.edu. And for all your primary health care needs, visit University Medical Center with locations in Tuscaloosa, Northport, Demopolis, Fayette, Carrollton, and Livingston. Thanks for watching, and we'll see you next time on Health Matters.
When we come back, a look at the services University Medical Center offers and where they're located. Stay with us. Welcome back. We want to take a minute to explain how the University Medical Center works. It's a unique healthcare system designed to provide medical service to a wide array of patients.
Hello, I'm Dr. Richard Friend. Taking control of and improving your health requires the most relevant and timely health information available. And University Medical Center is here to help with facts and advice about important health topics that you care about. We know that your health matters. So University Medical Center is part of the College of Community Health Sciences. College of Community Health Sciences does a lot of things, but we run and operate the University Medical Center, which is a primary care medicine specialty practice. And by that I mean we focus on primary care. We have family medicine, internal medicine, pediatrics, OBGYN, psychiatry, psychology, as well as endocrinology and neurology. So we're very busy here at our main location, but we also have locations in 5 other locations, one in Northport. We have a brand new clinic down there right behind the Lowe's and Aldi's by the Tuscaloosa Airport. We also have a clinic in Carrollton, Alabama, which is in Pickens County. Fayette, we do prenatal care, which is a service that's much needed there. There are no OBGYNs up in that area, so those patients come see us, and then we deliver them either at the DCH or Northport campus. We also have clinics in Sumter County and Marengo County.
But University Medical Center sees patients in more than just the University of Alabama campus area. The Fayette location fills a huge medical need by offering prenatal and pregnancy care.
So the first thing that I always recommend for a newly established pregnant patient to do is to start a prenatal vitamin. And once they've done that, they can call our clinic. We have a clinic and we are here 3 days a week. We are here on Tuesdays, Thursdays, and Fridays. We have someone who is always available to answer. We also have an after hours line. So once our clinic hours are over for the day, we have an after hours line that they can call, and it will be routed to a physician that can answer any questions that they have. Once they get set up, they'll get established as a new patient. They will come in, they'll have their ultrasound, they'll meet with a nurse to go over all of their prenatal education, and then they will get established.
One of the newest locations is in Carrollton in Pickens County. They offer everything from pediatrics to geriatrics and diagnostics to sports medicine.
So the clinic opened in the summer, roughly a few years ago, about 2021, I believe. And so we've been open for about going on 3 years. We offer pretty much full scope family practice, family medicine, from prenatal services, pediatrics, geriatrics, not truly sports medicine, but we do offer some kind of sports medicine services. We are in the process of getting x-ray. We have the equipment installed. We're just working on kind of the back end, the programming and things. So we'll have that hopefully up and running within the year. We do, like I said, do prenatal, so we do some other GYN procedures as well, GYN services and women's health. We have a provider who comes out here to just do that. We also offer services to the Aliceville prison for the inmates at the prison, so we do provide women's health services for them as well.
And University Medical Center has a location in Sumter County. The Livingston Clinic helps fill a void for well visits and immunizations, as well as treatment for chronic conditions.
The services that we currently offer is more family medicine. So we see pediatrics. A lot of the pediatric patients that come to us are coming for wellness visits, sick visits, immunizations. We also see the adult population. So a lot of the patients that we see are being seen for chronic conditions, diabetes, hypertension, some kidney issues, and then our geriatric population, where we just try to keep them maintained, make sure that they have good medication management, and they do come to us quite often, probably on a monthly to quarterly basis, just to make sure that they are maintaining all of the things that we have in their plan of care.
You can hear the entire interview by visiting our website at umc.ua.edu. And for all your primary health care needs, visit University Medical Center with locations in Tuscaloosa, Northport, Demopolis, Fayette, Carrollton, and Livingston. Thanks for watching, and we'll see you next time on Health Matters.
Thanks for watching. Our special thanks to University Medical Center for their partnership throughout the year. Have a safe and healthy 2025. Good night.